My name is Darryl Cannady II. I'm in orthopedic surgery with specialized training in hip and knee reconstruction. I grew up in Gainesville, Florida. For the first 22 years of my life, went to University of Florida, go Gators. Then moved to Miami, where I attended University of Miami for my medical school training, go Canes as well. Later on, I then moved to Orlando to attend the Orlando Health Orthopedic Residency program. So as you can see, there's a trend. I'm a Floridian through and through. My last year, I actually moved out to California and lived in Los Angeles, where I got to train at the University of California, Los Angeles, where I got my hip and knee reconstruction specialization. Had a great time out there, learned a lot in my orthopedic residency in Orlando Health with pretty much any general orthopedic concerns. And with my specialized training in hip and knee reconstruction at UCLA, made me almost an expert at this point in hip and knee reconstruction. Everybody has the injury story where they got an injury. I've had an injury. I've had my patella was actually dislocating multiple times when I was a kid. I did have 2 surgeries. I actually unfortunately missed my prom, but I was able to hang out with my friends at the time. But my interest also lied in the science of it and the musculoskeletal system. I developed a deep interest in anatomy, musculoskeletal anatomy specifically when I was in high school as well as in college. The first time I actually shadowed a doctor was in college. I was an emergency physician. I actually got to tag along with the orthopedic residents at the time. And they showed me how to do closed reductions in the ED. They showed me how to do wound closures in the ED. I got to learn how to read x-rays at the time. My interest then developed, and I actually joined a musculoskeletal lab while I was at University of Florida, where I actually looked at the musculoskeletal system in relation to hormones, testosterone, estradiol, and sclerostin. My interest then continued to develop. I got to medical school, got to shadow behind orthopedic residents again at that time, help them out in the ED and really get my hands onto it. And I just fell in love with it after the first 2 years of medical school, and committed to it ever since. And now here I am, so love orthopedic surgery. As much as I love operating, I do also love taking care of people non-operatively, because obviously everybody isn't an operative candidate, but if I can help you with your musculoskeletal pain or with your musculoskeletal issues in a non-operative way, I'm happy with that as well. But I love being able to go in and being able to adjust your anatomy so that you're pain-free. Being hired at South Florida Orthopaedics, it did hire me as a hip and knee reconstruction specialist, but I also practice general orthopedics, so I'll see a broader range of patients. I do have a keen interest in primary total knee, primary total hip replacement, as well as revision hip and revision knee replacement. Luckily, at the University of California, Los Angeles AMA Orthopedic Residency program, I was also able to get some training in total shoulder replacement as well. I also have done a lot of fracture work, so ankle fractures, periprosthetic fractures, or periprosthetic fractures where you have a fracture around an implant, so that we would have to fix back. So I would see those patients as well. But I would see a broad range of patients at this point. I do play video games, so I play with my friends online because some of them are long distance, so I get online and we'll enjoy our time there. I love going to breweries. I play basketball. I also have a gym in my garage, so I have a squat rack and I have treadmills, so I try and work out as much as I can. And then just enjoying the beach, reading books. I have a Kindle, so that's actually saved a lot of space in my house. Even though I do love reading the normal books, having a Kindle just allows me to download books and do that, enjoy that. Love seeing new movies. I'm a particular fan of action movies and horror movies as well. So I just got into the horror scene about 3 or 4 years ago. And then golfing. So I'm not very good right now, but I do love to go out there, and I am seeing improvements over the time. So one of my patients know on me that I would treat them like any other family member. When you're stepping foot into my clinic setting, you'll be treated like your family. I want to take care of you. I want to make you better. I want to take as much pain as I can away. I want you to get back to your activities of daily living. I've had patients send pictures to our office, and they're going on boats, they're able to do their walk marathons, they're able to get back to what they enjoy. So that's the most rewarding part of my job.